Hi, I'm Dr. Santoshi. As we know, the skin and the mind cannot be separated. So, without taking into account a mental health of a patient, we'll not be doing the patient any form of justice if we just hand them out a prescription to treat their skin condition. That said, some very specific skin conditions, they worsen when the mental health suffers. I'm going to look at them one by one. The first among them being psoriasis, because it is a skin condition which is proven time and again to worsen when exposed to undue amounts of mental stress. Now, psoriasis is a chronic inflammatory condition where the patient experiences rashes, in simpler terms, in non-medical terms, rashes on the skin, more like scales, reddish, raised scales all over the body, and the severity varies, of course. Some of them will have very minimal involvement of the skin, just something that they perceive as dandruff on their scalp, and sometimes the entire body is involved, including their nails. Now, psoriasis is a chronic inflammatory condition that is not just limited to the skin. In fact, they've found that it also affects the cardiovascular health of a patient. Even if they do not have any other risk factors, psoriasis itself is considered to be an independent risk factor for poor cardiovascular prognosis. So, all of these factors have to be taken into effect. Not to mention, a patient with psoriasis is, of course, naturally concerned about the appearance of the scales. Many people consider psoriasis to be, very stigmatizing disease, because people do not know that it is not contagious. So the moment someone with psoriasis of any severity walks into a public place, there may be individuals who shy away from them, who move away from them. So all of these can have very negative consequences for someone's self-esteem, right? And not to mention that it is also inflamed, irritated skin. So they may experience itching, they may experience poor sleep. So this also affects their mental health adversely. Now that is the mental health part of it. It also affects intimate relationships, job opportunities, confidence, and it really limits the ability of an individual to perform their roles in different aspects of their lives, all right? So for that matter, it kind of traps them. And that said, it's also a disease that is pretty much lifelong. No cure exists. The symptoms can be kept under control. There are known triggers. Some of the triggers are cold weather, infections, and of course, psychological stress. It's one of the skin diseases time and again proven to have a very strong correlation with the stress levels that the individual experiences. And of course, there are independent associated psychological morbidities like depression, suicidal thoughts, suicidal ideation. All these are also more prevalent in individuals with psoriasis. We can never discount and we can never downplay the impact psoriasis has on someone's mental health. So when a patient with psoriasis walks into the OPD, we ask them, how are your symptoms? How is the creams that I gave you, the medicines that I gave you, have they improved your symptoms? The redness has reduced, the thickness of the plaques, that is the thickness of the skin lesions, they've reduced, you're doing good. We should also ask them, so how has it improved your quality of life? How is your performance at work, your personal relationships? Do you feel more confident? Has your self-esteem improved? Do you sleep better? Are you happier? How is your functioning otherwise? Do you feel conscious to go to the gym? Do you feel conscious to go to the swimming pool? So we need to address these aspects of treatment as well. Without that, of course, it's very incomplete. And it would help that anytime a patient with psoriasis walks in, we administer a quality of life questionnaire to them, so that objectively they can also measure and we can also measure the impact that the illness has on the patient, and also the effect of our treatment. That is about psoriasis. So we also found that treating the patient's skin condition has a positive impact on the patient's mental health. So be it topical treatments, be it your systemic treatments, all of them reduce the inflammation going on in the patient's system, and this also creates a positive impact on the patient's mental health. So apart from the dermatology focused treatment that we administer to a patient with psoriasis, there are some concrete methods that we can ask the patient to employ to better equip them to handle the stress and the impact it has on their skin disease, and vice versa. So some of them specifically that I want to emphasize on are mindfulness-based stress reduction techniques. So now what is mindfulness? Mindfulness is a form of meditation, so to speak, where you observe what's happening around you with interest, with intention, in a non-judgmental way. A lot of people akin this to a feather touching the rim of a glass. That's how gentle your focus has to be, and no matter what you are feeling at that point in time, you allow it to come and go. More like, you're sitting in a train station, you're witnessing a whole bunch of trains coming and going, but you don't try to get onto any of the trains, but you're just sitting. The moment you get onto a train, you realize, no, your destination is still the platform, and then you get back down and you keep observing the trains. Do not fight the negative thoughts, do not annotate them as negative, positive. So hold back on the judgment and just observe things, observe thoughts, observe feelings as they arise, and watch them come and die their natural death. So mindfulness is something that is proven to help in many disorders, not just skin disorders. Okay, and people have found that there are actually structural changes that happen in the brain in practitioners of mindfulness, right? So mindfulness-based stress reduction, there are equipped therapists who can guide the patients in this regard. Mindfulness-based cognitive therapy, and of course, there's also encourage the patients to undergo, disease-focused therapy. For example, if they have comorbid depression, encourage your patient to take treatment for it as well. Okay, and do not ever disregard the feelings of the patient by telling them that this is not life-threatening, so it's not going to kill you, but it does, threaten the lifestyle of a patient in so many ways that some patients may end up having suicidal, ideation, suicidal thoughts, because in their mind, the skin issue has been, it's taken to the forefront, and it occupies so much mind space that they really do not have, even if they wanted to, they do not have the energy or time to focus on other aspects of their life. It can become the sole focus of, energy in their entire life. All their energy is spent towards dealing with the psoriasis. So you can only imagine, some of us may have experienced one rash or the other at some point in our time, and it's a very uncomfortable thing to have, constantly have something on your skin. So just imagine patients with psoriasis who have plaques covering large surface areas. So we have to be kind, empathetic, understand what the patient has been going through, and even if the patient is not very willing to open up about their mental health, the very first interaction with you, we have to create a safe space where the patient feels that they can talk about what they feel to you, even as a skin doctor, and that you will help them in all ways that you can, refer them to a psychiatrist or refer them to a therapist or a psychologist or anything of that sort. Help should be made available to patients in any form for that matter. So for that, first we have to be aware that mental health and psoriasis go hand in hand, and we have to be aware that there is no stigma in suffering from any form of mental illness. I've noticed that many people who suffer from mental illness refuse to come forward, and because first of all, there's a lot of stigma and shame associated with it. So we as medical practitioners, we have to take an oath it's time to end this shame and stigma. We have to take concrete steps to make it something normal. 1 in 4 people suffer from mental illness at some point in their time, according to statistics. It could be anyone in the room. It could be you, it could be your loved one. So we have to have that kind of empathy. We have to have that kind of understanding, and we have to treat our patients in a holistic manner. And of course, lifestyle changes help patients with psoriasis. Exercise is a natural endorphin booster, and any form of aerobic exercise can boost the endorphins, which are the happy hormones in your blood. So following a healthy lifestyle is non-negotiable, especially for patients with psoriasis, because psoriasis is an independent cardiovascular risk factor. So encouraging them to consume healthy fats, reduce unhealthy carbs, avoid processed foods and junk, and to increase their intake of omega-3 fatty acids, and to incorporate mindfulness, yoga, and any other form of stress reduction that works for them into their life is probably on top of the prescription for someone suffering from psoriasis.